So just to jump in, I would love to just hear from you guys a little bit about why do you think this work that we're doing and going after this tower and building this tower, why do you think it's important? What importance does this tower have for us here in the work that we do?
I think that the vast majority of our 125-year history, a large portion of it has really been focused on how we can serve patients from an inpatient perspective. So patients that need to be hospitalized, and of course that's incredible work, and it has come a long way. It has carried us a long way, and it's still a noble mission. But I'm very excited and happy as an outpatient provider that we're going to be capturing those patients who are not in the hospital.
Sure.
Whether that's patients that are out in the community, whether that's patients that have been hospitalized with us before and have now been discharged into the care of their family. There is so much beyond what can be accomplished in a hospital bed. There are so many extra years or decades that we can capture for that patient. And now in particular, with so many different service lines, we can really far more comprehensively meet that child's needs as well.
Absolutely.
I think it signifies to the patients and families that we serve that we see them and we want to be there for them. We want to meet the needs that maybe aren't being met at other places. And right. Hopefully that conveys a message of hope to the staff as well, that we're there to grow and meet the needs of them too.
Absolutely. Yeah.
I think it's something that's really exciting, something that has always been really profound here is that I've always felt very supported as a provider, and I know that our teams feel that way. And so by building this new building, it is, a way that it's showing like, yeah, we believe in you too. We think that there's some great opportunities. And so I think it gives us the opportunity to even dream bigger and bigger Sure. and bigger, whether that's like seeing more patients, of course, or being able to get some great new equipment and just really being able to kind of broaden our patient spectrum and being able to serve more patients, but also maybe different kinds of patients. Absolutely. So I think it's really exciting.
Absolutely. We have seen, I think here recently, some really fun things we've been able to do that are new and innovative. So just having more space really, like you said, I think it creates just a greater capacity to dream, imagine, and innovate.
We're not only improving volume, but quality. And I say that because we've started this initiative towards multidisciplinary clinics, but we haven't been able to progress in terms of creating dedicated space towards these teams to meet
Sure.
and actually allow families to actually be a part of that Sure. as well. Yeah. The other part of it is the procedural aspects. So within the realm of physiatry, we do a lot of procedures or botulinum toxin injections, and it will really improve the efficiency of the number of patients we can see. I think it's a very important part that's going to help us with the realm of quality.
We had talked about the concept of medical neighborhood. Yeah. And I love that concept of not just their medical home, which is more of a primary care emphasis, but neighborhood, where you have your core subspecialties that meet that child's needs, especially our patient population who often have very complex needs. They don't just have neurology, they don't just have physiatry needs, primary care needs. All their different aspects coming together in one place that's so cooperative. And that's one of the things I love about Bethany Children's is that we talk to each other and we are in and we know our patients and we're communicating about them and making sure what I'm doing is not affecting what you're doing in a negative way or right. vice versa, right. so that we're doing it in the most cooperative manner for the best for the child, for the best for the child's family too, right. and who often right. play into that. Yeah. The therapy needs, the psychiatry needs, all of that comes together. And we're not stepping on each other's toes, but rather cooperating and coordinating with
right.
each other.
It's awesome.
I would say that being able to get the right treatment at the right time can be life-changing for patients and for families. So being able to grow and expand and offer new services will just make so much of a difference for the patients, but also for us to be able to give the patients what they need.
Absolutely.
If we can be the one-stop shop for all of the patient's needs, or potentially the vast majority of the patient's needs, then their care is far more comprehensive, it's far more streamlined. There hopefully will not be unmet needs, and we can kind of be a bastion of medical care, not just in the surrounding area, but really in the state and beyond. There's also a lot that we can do from a telehealth standpoint. So having the space for more technology so that we can reach even beyond these walls. No matter how many buildings we build, we are localized within Bethany.
Right.
And we should, and we will now be able to have really far-reaching outputs. So we can partner with other providers out in the community for families that maybe aren't able to make the trip. Maybe it's weekly appointments, maybe it's monthly appointments, and that can be a huge burden, especially when your child has complex medical needs. And so we can partner with other providers out in the community. We can do remote patient monitoring now, new technology to where we can serve patients that may be hundreds of miles away. And a new building will unlock that potential.
Yeah, it's awesome.
As well as the organizations that we can partner with as well that might be communities like the Cerebral Palsy Conference that we host here. We were really bursting at the seams. Might be that conference, but maybe many other conferences, especially school-oriented. I know we have a lot of initiatives that look at community safety things,
Sure.
that we train the entire state in these efforts. And not only just in the clinic, here's a medication, but here's how we keep kids safe on so many different levels.
To me, it really aligns with this idea that we've been discussing of, expanding the boundaries of where we are, but that means things other than just physical location. That means being in their home, but also it might mean just innovative programming and expansion of what we do into new spaces that aligns with the central core of who we are and why we're here.
I think we're such an incredible community. We offer so much, and we have, like you were saying, all the amazing programs and community outreach. And I think that by having this new space, it's just going to get bigger and bigger, and we can welcome more and more people in.
Absolutely. I love it. So final question for you all is what excites you most about the future here at Bethany Children's? What excites you the most?
I think really being front runners for the type of care that we provide. Really, this is a new area of care, this idea of serving children with complex medical needs. And so there really is the opportunity, the capacity, and certainly here there is the mission and the values and the drive to really dig into what that means. And as others have mentioned, I mean, that means not just meeting the child's needs, it also means teaching future providers. And it means performing research and contributing to evidence-based medicine. There is so much potential here because of the very unique practice that we have in this outpatient tower. Really helps to unlock that potential.
I think breaking down those old world views of siloed care and how everybody, kind of operate in their own little bubble and specialties. And we've kind of broken down that whole paradigm and that feeling of like, well, that belongs to a neurologist and we'll let them take care of it. It's done away with that whole old school thinking and really brought together the synergy of working together. I think the energy the families get from seeing that interaction is, they're very, very enthusiastic about seeing all these different providers speaking about their child like in real world time and not having to wait till another 6 months to see that other specialist and try to find out. So I think that's really cool.
More of it to come.
We always hear from families how surprised they are about how, we've communicated about a patient and it's just happened so quickly. And I think that's something that I've loved about working here this whole time. And I think it's just going to get more and more as we add more specialties and different providers. But I've learned so much from everyone else. And I think that each of us becomes a better provider in whatever our discipline is just by learning from other people. And so bringing more people in that have specialties in certain things or passions in different areas, and also bringing in patients that might just kind of blow our minds, and we have to really work together and do the research and figure out exactly what they need. I think it's going to be incredible, and I think things are going to happen that we can't even imagine.